In terms of the COVID situation in Idaho, we appear to be in the thick of it, the worst our state has seen. At the pandemic's peak, probably, or at least close to it. Crisis standards are now the norm in Idaho as we continue to see a level of COVID infections, hospitalizations, and deaths that keep rising. But are we about to turn the corner, maybe descend on the other side of this climb? It's a question we've asked a lot in recent weeks, and so have our overworked healthcare workers. Our peak is yet to come, however, according to Joe Paris and the state's new COVID model. He gives us insight on when we could hit our COVID peak and what that might look like.
Across the board, Idaho continues to struggle with COVID challenges. A major teller of that is new COVID data points.
The hospitalization numbers continue to set record highs. You can see in this chart that our number of patients in the hospital was at an average of 757 last week. That's a record. Our ICU patients was at 202 on average, again another record, and ventilator usage was at 131, more than double the previous high.
New data also shows a concerning trend for one demographic, children.
Weekly case counts among children are increasing more rapidly than our case counts among adults. In fact, infections among children have reached record levels in the past few weeks, and right now 20% of all new cases being reported are infections in children, which is much higher than what we were seeing this time last year.
So where are we headed, and when will Idaho hit its COVID peak? For starters, Dr. Catherine Turner, Deputy State Epidemiologist, says when looking at COVID projections, it's important to keep a few things in mind.
You can't really see how well a model worked until you look backwards, and we always say that projection is not predictions.
Turner explains it can be difficult to make precise assumptions about human behavior, and so projections should not be interpreted as predictions. With that said, here's the projected outlook for Idaho's COVID peak according to the state's model, which is a combination of multiple projections.
What it tells us right now is that we are tracking, in Idaho specifically, we're tracking at the high end of the projections. And so if it holds true, we could see in mid-November, upwards of 20,000 cases reported in a week.
Dr. Turner adds that hospitalizations could peak at 1,900 hospitalizations in a single week in late November, and deaths could also peak at 305 deaths in a week, also in late November. It's important to note that the model assumes that children under 12 aren't being vaccinated, but that could change if and when a vaccine is ready for them, thus changing the model. While it is wait and see, there is hope that Idaho could follow comparable states in the southeast that are also dealing with COVID surges. Dr. Turner says, assuming our experience is somewhat similar to other states that are now on the downside of their recent peaks, Idaho could follow suit. Here's what we saw. Cases plateaued in the southeast for a couple of weeks before declining pretty rapidly. There is hope that a similar pattern could soon happen in Idaho.
If we can all do the right thing and get those case counts down, and we won't see that sort of peak in mid-November, we'll flatten that curve, and we may still hit a peak in November, but it would be a lower number of cases.
All right, Joe, 20,000 cases a week by the end of November. It wasn't that long ago. Was it like back about a month ago, maybe a couple weeks ago? We heard August. Okay, so October, they were telling us we could see 30,000 cases in October, a week.
Yeah, so one thing to really point out with these projections and these models is they do change based on a variety of integers and different factors. So the model that we had earlier this year and also back in August, it's not necessarily wrong, but certain things have changed. For instance, the Delta variant is far more contagious, and we've learned more about how contagious it is than the Alpha strain. So that changes the model. The vaccine rates and the uptake, that may not have been exactly according to the model. So when you take a look at the projections and the models and the charts, there's a lot that goes into them. And if even one factor changes a little bit, the model itself also changes a lot. So there's also a big difference between projections and models and data itself. When we report daily case counts, that's the data that we have. The projections takes all the data from the state of Idaho and also regions that are similar to Idaho, and it kind of powers an equation to show this is what could happen if X, Y, and Z happen. But if something changes in the projection, Brian, the whole model does.
Well, so we're averaging about 1,200 cases a day right now. Are 20,000 cases a week? Are there that many people in Idaho to where this disease can still spread? That's my question.
The answer is yes, and our low vaccine rates are powering that entire situation.
Wow. All right. Those are numbers we're going to keep an eye on. Thank you very much, Joe.